Coronavirus cases are surging across Europe, and officials in Belgium say the health situation there is now worse than in March during the first wave, with cases of infection reaching new highs, the number of people in hospital doubling every single week. The government's ordered bars and restaurants to close for 4 weeks, while most employees have been told to work from home, and a nighttime curfew came into effect from midnight last night. Well, earlier I spoke to our correspondent, Dave Keating. He told me about the latest situation in Belgian hospitals.
Right now, the hospitals are still under capacity. There's about 2,500 people in Belgium in hospital for coronavirus, and there's about 252 new cases per day. That was the average over the past week. New hospital admissions, that is. That may seem like a pretty low number, but it's a big increase. That's an 80% increase, and the government is worried that if that figure keeps increasing, the hospitals are going to become overwhelmed. Don't forget, of course, new case numbers. There's a lag between new case numbers and hospital admissions and deaths. And so they're worried that the big increase we've seen over the past 2 weeks in terms of cases will be followed by a big increase of deaths 2 weeks from now. So they want to get ahead of that. Of course, the big increase in cases, we're up to about 8,000 new cases per day. That can be largely explained by the big increase in testing. Back in the spring, it was almost impossible to get a coronavirus test here. Now it's very easy. We have a coronavirus tracing app called Corona Alert that automatically tells you if you've been near someone who's been diagnosed positive. But the government says even the increase in testing can't explain the big increase in cases, because the cases are going up at a higher percent than the percentage increase of testing. So the hospitalizations and deaths still do remain low, especially compared to the spring. But the concern is if the pattern follows the increase of infections over the past 2 weeks, we'll see a big increase very shortly. So we'll have to wait and see if these measures have an effect.